So,
All right, well, good evening. My clock says it's 5:30, so we're going to go ahead and get started. We welcome those who are joining us here in the boardroom and those who are joining us virtually. Please join us for the Pledge of Allegiance. I pledge
allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
Thank you. Item 1.3 is approval of the agenda.
So moved.
Thank you. We have a motion and a second. Any discussion? All in favor of approval, please say aye.
Aye.
Any opposed, nay? Chair votes aye and the agenda is approved. Item 1.4 is input from the public. This is a period devoted to comments by the general public, if any, and discussion of those comments. In the interest of privacy and due process, the public is requested to not raise personnel issues except in a legally noticed closed personnel session of the board. No action may be taken upon a matter raised. Is there anyone who wishes to comment?
Hi, for the record, Dr. Bryce Putnam. I'm the Elko County Health Officer. I'm also the Regional Director for the CDC Foundation under the COVID-19 Corps. So I am here to just say welcome, or I'm feeling really welcome. Everybody said hi to me. And just to give you an update on what's going on in the county and to give all of the members here today a really big kudos, as well as all the teachers, staff, nurses, and everyone in the Elko County School District, because what I'm seeing is fantastic. So from the standpoint of the county, what we're seeing an excessive increase in numbers. From the last board meeting till now, you guys were in a situation where I said, I don't know, is this a situation where we're putting you in a situation to fail? And I was really worried about that. But what I've seen is the opposite. I wish that the community in general would help the school district out more with their responsibilities into the community. I will say that, and I will say that for the record, because nationally what we've seen is that as we have increased numbers in communities, it directly affects schools and the positivity rates in schools, and for those schools to possibly shut down. And what I've seen is a really good plan, and I've seen individual schools with some direct, really good ingenuity, and some of the plans are tailored to their specific schools. And some of the reports that I've been getting about some of the contacts that were with positives and some of the interventions that have been done by principals, nurses, staff members have blown me away. And I will say this is that when I was seeing that the numbers were increasing, we had a lot of positive students and staff. And with that being said, we've worked around that. I am in contact with Bobby Shanks and as well as Dr. Robinson about some of the tougher situations. And I just want to let everybody know in Elko County and all of you that I'm here for support. If there's a tough decision that needs to be made, I do not mind making it. I don't mind publicly saying what I think is best for the students, what is best for the safety of the students, the staff, and all of you, and as well as our communities at large in the county. But what I'm seeing is that all of these situations have been talked to me about certain schools, and those thought processes have been really well thought out. And when it gets to me, I just kind of shake my head and say, that's very appropriate. With the governor's address the other day, he's made a stance, and I agree from the standpoint that we need to keep our kids in school. And it's really a nice thing to see from the standpoint of months of preparation that this was delivered in some of the most trying times, and Elko County School District and all its members are delivering. And I guess my message today would be that I would love for the county and all the communities and the people to really help us out, because as the positivity rate still is increasing, we're going to see a lot more positives in schools, which is going to detrimentally affect whether kids can go to class or not. And if we have, close contacts or 8 and 9 students, it might be the decision of the nurses or Dr. Robinson, or even in consultation with me to shut down the classroom. But we're going to do everything we can to not shut down schools. It's not in anybody's best interest. Now, if that came about, I would come over here and I'd say, that was my recommendation, and this is why. But I haven't seen that. I've seen some really good processes, and I just want to thank all of you, as well as the teachers, staff, nurses, and everybody who has made these plans, who have executed these plans, and has been well thought out. And I honestly appreciate all of the support, and I'm here to answer questions for you guys as well.
Since we know you're busy and we had you go a little bit early, we'll go ahead and let the board ask questions if they've got questions.
Dr. Putnam, are you concerned about the hospital space at all? Are there plans to do something about that?
So the Northern Nevada Regional Hospital has done an excellent job in the capacity is not the issue, it's the staffing. The amount of beds that they have is very adequate. It's the amount of staff, and that's what we're faced with all over. My biggest concern is that in Utah, Idaho, and some of our surrounding states, especially at the University of Utah, where last week they were at 108% of ICU capacity, they were not accepting patients. And with as many people from our area that go to Salt Lake for care, that's disconcerting, especially when some of the care that is needed for these COVID patients is beyond the scope of what we're able to do in our hospital. So we fly them, and that is not to say that they're not receiving excellent care. It's because they're more suited in some of these bigger hospitals to take care of the long-term needs of COVID-19 patients, because some people are on respirators for 30 days. And when they get to that point, they really need that a long-term facility, and University of Utah is one of those people. Now, if they can't take that influx from ours, we get to the point to where do we send our people? And, the nice thing is that Renown Medical in Reno has opened up a parking garage that they're treating, COVID-19 patients. So right now, I'm confident that, and I'm saying right now because we're seeing an influx everywhere, that we still have that staffing model that we can send people if needed. Now, am I directly concerned about our hospital? Always, because with the numbers we're seeing at any point, if these hit some of our patients that are in their 80s and 90s with underlying health conditions, we could see an influx that could overwhelm our healthcare system at any time. So is there plans in place? Yes, but none of us want to see that point to where the amount of patients in our hospital is making it so it's not available for people that have a heart attack, or people who are in a car accident, all the things that we've seen throughout the years here in Northern Nevada, especially when there's icy roads, especially as the winter is changing. So yes, it's very concerning. Yes, there are plans in place. And worst case scenario is that we have to do the best we can. So with these numbers, and that's why I keep urging the community to follow the directives, because here in Elko County, we haven't. I'll say it, we're still fighting with masks, and we're still fighting with social distancing, and we're still fighting with crowds. And we have created an experiment situation that has failed. And right now is a critical time for us to take personal accountability of our own lives and our own decisions throughout the community and say, this isn't working. So if we want to keep kids in school, if we want to keep businesses open, if we want to keep all of the things that we have to take some personal accountability as a community, and we have to do it together and understand that as these cases rise, this could be our reality, and we don't want to see it. And, the governor has put us on a 3-week pause, and hopefully things change. But with the holidays coming up, another service announcement from me is to urge everybody to follow the directives of the governor, just so we don't have, because in my mind, I'm thinking right after Thanksgiving, that 4 days afterward, we're going to see a record number of tests, a record number of positives, and I just want Elko County to prove me wrong.
And is there a threshold or positivity rate? I noticed in the paper today it was up to 21.6, I think. Is there some threshold that you're looking at to say schools can't operate, or we have?
No, it's not so much the positivity rate. It's the, when we start seeing what I would call an exponential community spread. Right now we have mass amounts of community spread, and then families are, passing it on to each other, which is expected because they're living in the same household. But when we see that, when we go from, we thought busy days were 20, and then it went up to 30, and now we're averaging between 45 and 80. And, when it gets past that, I'm saying, okay, I'm looking at age groups. How many of those are between the ages of 60 and up? How many people have underlying health conditions? How many people are going to the emergency room on those days? And as hospital capacities increase, those are the things that the state is going to be looking for as far as, wow, we need to really pause. So as long as we can keep the hospitalizations, around 80% and still have some availability for other things besides COVID, because, the rest of the world is still living their lives, and we need to realize that as well. So I'm looking at those, but you would certainly hear a very stark warning from me on the airwaves if it got to that point.
I have a question. And first of all, thank you so much for coming tonight and for everything you've done since the beginning.
Thank you.
My question is more on, now that we know more about the virus and we have a better understanding of how it's transmitted and how to react to it, if I look at the dashboard in the school district, we're looking at 63 total cases since I think it started in June, correct? And active cases is 21, staff is 23, 21 was for the students. Current exclusions for students is 663. So is there a way for you to guide us, or the CDC guidelines? The secondary contact tracing, for example, my wife was in contact with somebody, do I get stopped, and then does it trickle down to my daughter? And then so, you understand what I'm saying? So that we're cautious when we're excluding children, but not overly cautious that one kid keeps getting sent home every month.
Right, and that's a good question, because the only discrepancy that I have with how we're handling this is that sometimes I think that the quarantine levels for students and staff is a little bit too robust. And I will be making some formal recommendations to Dr. Robinson as well as Bobby Shanks about really switching that model. So, because what I don't want is for parents to be penalized for having their kids in school. So if there is a primary contact and we're going to test that person and then they're out for 14 days, I don't want them to be out for 20 or 30 days and having to stay home, because that directly affects their bottom line as far as livelihood. It affects the economy, and it affects the students from being here. So there's some things that I'd like to talk offline with to make sure that we can get that streamlined, so we can get kids back quicker, we can get staff back quicker, and do it in a way that is scientifically proven, not just, I'm just saying that it works. It really does. But as far as contact tracing, we are working with our contact tracers. I have, I think, 16 of them, and Amber's going to kill me if I'm wrong, but I think it's right around 16, 17. And they're in contact, as well as your internal contact tracing that you're doing in schools. Because I hear some really good stories about schools doing some contact tracing, and they've done a really good job.
No, the nurses are doing a great job with that. I don't want them to get overloaded either.
And that comes a situation where we had last week, where we had a school that had 8 contacts, and the contact tracing got so convoluted to where it was the easiest option and the safest option was, hey, you need to give this class a break for 14 days, let them restart up, because the chances of missing one of those contacts and passing it on could shut down a whole bunch of people. So in order to do that, we just, you shut down that classroom, you give it a break, and then you come back all healthy as one. So I think that those efforts have been outstanding. Does that mean that a bunch of people could be affected at one time? Yeah, unfortunately it does. And trying to keep every kid in school to have a mask on, the teachers, the nurses, they're going to do the best they can. However, things are going to be missed. Things are not perfect. The real world doesn't live by the guidelines we put on paper. And we understand that. But it's certainly better for the teachers and staff, or teachers, nurses, and students to be honest if they weren't wearing a mask rather than pass the virus on. So there are going to be some times where there's going to be a significant amount of people out. But that doesn't mean that we can't work together and figure that out, because we do have some testing options now. Broadly, we will be giving out some of the, I ordered through the Department of Emergency Management, 10,000 of the new Binex Now tests. They will not be disseminated in schools because you need a lab to do it, and there are some guidelines. However, we will be giving them to some of the offices in town, and we can get those screened. I mean, these tests are so fast. They're 5 minutes and they're super accurate, 97% sensitivity. So I am very, and I've been using them since Saturday, and every single one of my positives, which has been around 21 positives, just from me and the staff that works at Nevada Health Centers, every one of them has done a rapid PCR on them to confirm, and it's 100%, it's been 100% accurate. So these things are really good, they're really quick, they're gonna get teachers and nurses and students back to class sooner, because we know that the waiting time for testing in this town is sometimes hard because of the amount of contacts that we're facing every day that need to be tested.
Well, that brings me to my last question with like you're saying, with the 3-week lapse that the governor put out, the pause. With Thanksgiving, it's supposed to end December 15th.
Right.
But with the lag of testing, we're not going to get the true results till probably a week after that 15th. So are you worried that we're going to be playing catch up?
No, I mean, I was worried we were going to play catch up about 3 weeks ago, because we just didn't have some of these rapid testing. And now that we're going to be able to disseminate that, I think that's going to catch us up quicker. Also, most of the people around town are not using the Nevada State Health Lab because there was a 7 to 10 day lag in test results, and that was unacceptable. So most people have had contracts with either Quest, LabCorp to get tests back within 2 to 3 days, which is much more reasonable and accurate and able to manage, as far as me, with disease mitigations throughout the county. And then with these fast tests, we'll get kids back sooner. And I even have policies right now at Nevada Health Centers that, with school notes ready we've already got these with Dr. Wynn, the director of University of Nevada's School of Medicine at the residency program at Nevada Health Centers. She and I have a note ready for those Binex Now tests to be done, get a note and go back to school. So we're trying to streamline the process for you guys too, because I don't want kids out of school any more than they have to be.
Okay. Well, perfect. Thank you so much for your time.
Yep.
Yeah. Following up a little bit on the question that Mr. Gerber had right there, with the different tests, with the Binex test, if the CLIA classification or the CLIA certification, the thing that I see, we have to have a regular PCR test in addition to that within a 48-hour period of time. And my question is trying to get the nurses to be able to administer the Binex test or something. It seems like we need to establish some community partners or something, whether it's Nevada Health Network or whatever. Is there a possibility that we can start to look at specifically doing that and getting some agreements put together? And, following up the next step, the exclusions, we've got an awful lot of people that are outside that have been excluded from the contact tracing. And it seems as though there should be a way that we could test those people or have them go get a test. And if, for the period of time, whatever's reasonable, if it's 5 to 7 days, At that point, if they come back with a negative test, that they're able to go back to work, because that exclusion's just really hurting us as a district for the number of teachers that are there that are being excluded. We don't have enough subs and that sort of thing. So it was encouraging to hear you say that you were working on perhaps some of the logistics of the protocol to ease some of that pressure.
Right. So perfect. First of that is that the Binacs now will not be able to be disseminated to the schools. Now, do I wish that? That was in my mind when we first did this. However, with the, I mean, I don't know how else to say it, but other than bureaucracy behind this, you know, it has to be a certified lab. I did want it to be used as a screening tool and not to be a diagnostic. That especially for nurses without licenses, and I mean having licenses but not having a medical personnel, a license under them to be able to make a diagnosis. You know, that's what I envisioned in my head. However, that's not the way it is. So we have to give this to medical partners throughout the community. And when that's all compiled, I would be happy to even send a list of all of those to all of you, so we can get the word out that these are the clinics that are using that test. And I'm even doing that in Wendover, Jackpot, and Carlin as well. So we want you to know that you know we're trying to disseminate it throughout the county for everyone. Right now I have 10,000, which will be used up very quickly. But I'll try to order more. So with that being said, also, you know, when you were talking about the contact tracing and getting someone negative, well, CDC regulations say if you're a close contact, you're out for 14 days from time of exposure. We can't do anything about that. However, there is some thought where if mom tests positive and you have a child, well, that child is automatically a close contact. So if that mom was tested and it was positive, that's a 10-day quarantine for her and 14 days for the kids. But Elko County School District is doing a little longer, where they're actually adding more on to the child's at the end. And that's what I want to talk about with Dr. Robinson and Bobby Shanks, to say, no, we really don't need to do that. I would love to see us not do any testing to get them back to school at all. Because that's the way the county does it, and that's the way everybody else does it, and as well as the CDC recommendations. Now, that doesn't mean that you can't have that. I have to test negative to get into school, but I will warn all of you that teachers, nurses, students that are positive may test positive for months. And it's not because they have active virus, it's just because it's in their nasopharynx. The virus is pretty much caked in there, and if you catch that with the Q-tip, the PCR machine does not know how to read the difference between live virus and dead virus. It just is a DNA, so it just reads the DNA molecule and says, you still have this. It doesn't mean they're active. And we know that from contact tracing that we don't have to do that. After 14 days, you can go back without testing. Now that's something that I'm just giving you as information. It doesn't mean that you have to do this or not, but if you want to lessen the time that teachers, students, and nurses are out because they're positive, that's the way we do it in the county. And I just want to let you know that with over 2,200 positive cases in this county, we've never had one contact traced after they've been let out of quarantine. And none of them had to have a negative test to go back. So that is something that I would recommend the board to think about in the future, because you're going to have teachers that are going to test positive for 30, 40 days. They don't have active virus. They can go back to school. It's not a big deal. They're going to test positive because it's still in their system. It doesn't mean that it's active. They're not going to transfer it to anyone. So I just want, that's a little piece of education. And it's also what we were talking about, getting people back faster. And you know, when you have sub problems and when you have those things, that could be a way for you guys to get students and staff back sooner.
Is the polymerase chain reaction test being done in a lab here then?
Yes, we do have a rapid one at Nevada Health Centers. from Abbott, and so we are actually doing the Binax tests for if it's appropriate, because sometimes it's not, because we have a protocol, and you call the COVID-19 hotline to get them on the schedule. We do the Binax Now test. If it's positive, then we run the PCR machine to double check it, because that's within the protocol. And like I said, those two things have always matched up. But if that's positive, then you don't have to wait the 48 hours. But to be honest with you, that doesn't matter, because if you're positive on Binax, and even if you have to do a send out, you're going to be isolated for a few days anyway. So that's not a big deal until it's actually definitive.
I have a quick question, Dr. Putnam. First, thank you for coming again.
Thanks.
You kind of touched on like the community buy-in. What can we do to increase that? Is that something, we're working very hard as a district to get the word out, like, we need you to follow these guidelines to keep schools open. Whether it's been successful or not is something else. And I know, I've talked to Amanda Osborne at the county, and I know there's a lot of mixed messaging coming from county leadership, from city leadership. Is that something like, do we need to go to them and ask them to help us, or do they have a plan to start messaging stronger that, let's keep our county open and our schools open?
And that's been my, I scream that out loud all the time, but, changing the hearts and minds of people is always the hardest thing to do. And I will say that I've done one thing really great, is that surround myself with wonderful people. And I've had a lot of failures, and that failure is to change the hearts and minds of people, because now we're at where we're at. And I think that with all of the leadership that was here previously, that has stepped forward and said we want kids in school, I think that it should be a reciprocal relationship, saying that if you want to keep kids in school, this is what we have to do. Yeah. And to be honest with you, it's going to take community support, and it has to be a reciprocal relationship built on mutual respect and personal accountability. So as anybody that would make that would be my hero. I mean, all of you should be saying that, because I think all the community leaders are starting to see the numbers where we are and say, now's the time. And if you reached out to them, and of course I sincerely will, because all the community leaders have the same goal, is to keep the economy going, get kids back in school. Everybody's intentions are good. It's just now we're all in this situation, and we have to recapitulate ourselves and say, now's the time that we all really have to work as a community to keep the kids in school, because we don't want the numbers to keep increasing, because then it's inevitable. But the governor has said we want to keep kids in school. This is a directive from him. And with that being said, we should all do our part. If everybody wants kids in school, then they need to do their part as well. And that's the personal accountability piece that I always talk about.
So Elko County Community Action Committee, if you're listening, all that help you offered, here you go. Here's what we need. Please call Dr. Putnam, find out what you can do.
Other questions from the board?
With being able to hear about anything on the news, a professional opinion from you on the vaccine, what's that gonna?
Vaccines, and this is going to be my next battle, is to look at the vaccine to convince people that it's going to be safe. And that's going to be hard to do here. But we need to reach 75%, 70 to 75% as a community. And we're not even including children in that right now, because the clinical trials for this vaccine have not been done for children. So we're not going to worry about that. We need the adults to take care of it. It does look to be good. There are some side effects which are going to bother some people. It is a new vaccine. It has never been done before, but it has been proven through the research that it is very effective at over 90%, which is excellent. So that's my next battle, is to prove to everyone. And I said I will be the first one to get it. And that's just me saying, this is a trusted vaccine. I will have it done in public, even if I'm the first one. So vaccine is very effective, but that's going to be the changing the hearts and minds for the next battle ahead of us, which is the vaccine. But the vaccine ends the war. And that's the nice thing about it.
So what if we get to the 70%, herd immunity number before the vaccine is available?
I hope
What do we?
that
how does
doesn't
that look?
happen. If that's Elko.
I'm just saying reality.
Sometimes I joke that Elko County strategy so far has been herd immunity, and we kind of joke about that, but that is not, we won't get there. Even if our numbers we won't get to 70% before the vaccine. And if it does, we're going to be in big trouble, big trouble.
And do you know if from what I've heard, you can get the antibodies, and then you can get reinfected. So is the vaccine going to be on the same line as the flu shot, where we'll have to have boosters every 2 years, 3 years, 5 years, so like the chickenpox every 10 years?
So they're working on this because there's 2 shots initially for the vaccine. One administered initially, and then 20 to 28 days later, the second shot has to be done. But as far as the time that it takes for the booster shot, I have not heard that. However, I'm assuming that there will be a booster shot for that as well.
And what is your message to teachers and staff, or parents even, that are worried about the schools being open and worried about infection rates and worried about, taking something home to their family or bringing it into the school and infecting people? What's your message to those people to help them through this time?
The message has always been the same. It's, when you're living in the same house, you're going to live as a family. However, our decisions what we do outside of work hours and outside of our family still remain. Science has proven that social distancing, mask wearing, and hand hygiene are the 3 keys. And if people really want to keep schools open, if people really want to not be infected, those are the 3 things that you have to do. And we've tried it the other way. And we can all say that this experiment of not wearing masks, not socially distancing, and I don't know about the hygiene, but it's irrelevant when you're not doing the first 2, hasn't worked. So let's try something different. Let's wear masks and socially distance. And with that being said, if you do that, our numbers will decrease, and we'll have a much more pleasant time keeping our kids and staff. But if I wanted to say anything to your staff in general, is congratulations. This has been an extraordinarily trying time. We opened up in the worst time, I can't even imagine a worse time that we opened. And we've been successful. Now, I'm sure we're pulling hair every single day, trying to get people to cover classes. But that was expected, and you guys are managing this extraordinarily well, and I couldn't be more proud of Elko County School District.
Other questions from the board? Well, Dr. Putnam, we really appreciate you coming, and we might invite you back again.
Anytime. Thanks for having me. I
We
appreciate it.
appreciate the update and the positive outlook.
Absolutely. Thank you.
Thank you.
Thank you.
Thank you. Thank you.
We'll move on to 1.5, announcement to advertise the Board of Trustees District 3 vacancy due to current appointees' term ending December 31st. So there's an announcement attached to the agenda, which I will go ahead and read. It says, the Elko County School District hereby declares a vacancy on the Board of Trustees due to the current appointee's term ending on December 31st, 2020. The successful candidate will be appointed for a 2-year term that expires on December 31st, 2022. The Board of Trustees is publishing this notice and seeking interested citizens for board consideration. Interested citizens must meet the legal requirements to be a member of the Board of Trustees. They must be at least 18 years of age, a citizen of the United States, a resident of the state of Nevada, and a resident of the Elko County School District, reside in District 3, which encompasses parts of Spring Creek, Carlin, and Mound Valley, a registered voter in the school district, and not a current employee of the Elko County School District. Interested citizens should send a letter expressing their interest to Ms. Cassandra Gray, Assistant to the Board of Trustees, Elko County School District, 850 Elm Street, Elko, Nevada 89801. This letter must be received in the superintendent's office no later than 2 p.m. on December 4th, 2020. So if anyone needs any of that information, again, please know that it's on board docs and you can look up that announcement. I believe it's also been in the newspaper and been published. Are there any questions from the board on the announcement? All right, that one's pretty simple. We'll move on to item 2.1, our superintendent's report.
Okay, thank you very much. I appreciate the board allowing Dr. Putnam to step in. He's incredibly busy, and I know he's sort of taking a break in between testing people, so on his behalf, I appreciate that. And I'm thrilled, and I just want to emphasize the incredible work that the staff and the administration and faculty have been doing in working in this unthinkable time and trying to figure out how you navigate a school through a pandemic. It's just, the two just don't go together, and everyone is just doing an extraordinary job. They're doing the very best they can every single day, and we have so much to learn, and I'm learning so much, but it is not because of a lack of trying and expertise and resiliency, and I am just so pleased that he was here to also to bring that out and to point that out, because you got to look for those really great things that are happening through this really difficult time. So, last Thursday, Adobe Middle School and Spring Creek Middle School welcomed students back to the classroom. So they're attending school in the hybrid model of both schools. That's the AA. Then there's a B, which is a Wednesday, which is all distance learning, and then CC, which is again, 2 different cohorts that are coming in. As I've said before, there are still things to work out. This is not, we don't have a perfect science on how you navigate the pandemic, but we continue to send students and staff home as the situations require, and that is across the district. But overall, the students just appeared very happy to be back in school, and parents expressed the pleasure at having their kids back in, even if it is in this altered scheduling. It's just, so we appreciate always the patience of our community and working with us as we are figuring this out. Our students are following restrictions, well, this is across the district, regarding the face coverings and the social distancing, and as well as the good hand hygiene. Cleaning continues to happen throughout the day, and all of which is working to support the transition into school, and as Dr. Putnam said, the ability to keep our children in school at whatever amount of time they're there. We remind parents to please check your child for symptoms, and please do that every day before they come to school. If they are not feeling well, please do not send them to school. Parents have asked if there is just one symptom, does that mean that they're going to be sent home? And the answer is yes. The same thing goes for our adults. These are CDC guidelines, and certainly if a child complains of a stomach ache or something, the nurses will take a look. If there's something else that will take care of that problem, then it is not considered a symptom. But they are not diagnosticians. They are following the guidelines closely. So please, if your child is showing symptoms, don't send them to school. As a staff member, if you are feeling symptoms, don't send your child to, or don't come to school. Let us know. Transportation is still something that we're keeping an eye on. We've now added a lot of children. Between the 2 middle schools, we have around 1,300 children that are now added to the schools, and a lot of those added to our bus routes. So we, again, appreciate the patience that our families are showing, as sometimes we have to adjust schedules on the fly. And we ask again, we encourage families where possible to please transport their children to and from school, particularly in the Elko and the Spring Creek area. This continues to help alleviate some of the congestion we have in scheduling our buses. So we appreciate the support and help along with that. We appreciate the cooperation and the flexibility from our school community. It's just been really difficult times, challenging times, but people have come through, and the community remains resilient, and we are appreciative.
Questions from the board?
Yeah, I had a couple of questions, Dr. Robinson. As far as our two large high schools, Elko High School and Spring Creek High School, are they still planning on a January 4th?
They are?
Return to school date?
Yeah, so both of the, if we're talking about specifically Elko High School and Spring Creek High School, they are both working with their reopening committees, which consist of faculty and staff and parents and students in the community, their school community. And they're working out the logistics and all of the things that, were challenges that we want to make sure are taken care of before they get in, but they are still working on a January 4th date.
And are they working at all in these committees trying to come up with some sort of magic ideas that would allow those kids to at least, get in there a couple days a week? Because I know I've gotten a lot of, feedback on the 1 day a week thing, as far as, why bother sending them then kind of thing. I've also noticed we have had a lot of kids that have, opted out to take the high set. And, I am concerned about how many of our kids how many kids are failing classes because they're just not showing up. How many are still just missing from the rolls that have never shown up. There are some serious concerns going on here with these two high schools. And so what I'm trying to get at, I guess, is that if we can come up with some sort of super out-of-the-box ideas using other venues of some sort or something and try to get these kids back to school. And I do feel like 1 day a week is not going to necessarily be adequate.
So these are all concerns and the issues that they're looking at, particularly these reopening committees, and being very realistic about the challenges to getting a large number of students on campus with limited spacing, still maintaining the 6-foot distancing and the other restrictions that are in place. We're finding it very challenging. And that's why the work that they're doing on these reopening committees is so important. Because, the more heads we have together, we can, the more out of the box thinking we can put together, the better. And they're really researching different ways. I want to be realistic and say that the challenges that they're working on are not changing. The 6-foot distancing is the biggest challenging, and the size of the classrooms and the amount of space. These are the things that are not changing, that are creating the greatest challenge to being able to increase the number of kids that are on campus at one time. But I know that they are looking at these things with the idea still that we want kids back in school because this is where we feel that they're going to be most successful. Now, as far as we recognize that there are challenges, unique challenges to being in a distance learning model that, we're coming up with. We were talking about this today. We've had students that, struggle in the traditional setting of a classroom, coming in every day, and we have constantly work on developing a tool bag of tools and strategies to help our children be successful. And now we have this different environment and we are developing tools and strategies to help them be successful. And both Elko High School and Spring Creek High School and, quite frankly, West Wendover High School is also out until January 4th. And so we want to, also mention the work that they're doing in interventions and things that they're putting in place and opportunities that they're providing students right now to come on campus and have that environment to be able to work with teachers and work in these environments that support their ability to get caught up. So, Mr. McEnany, I don't know if you want to speak to that a little bit, because I'm impressed with the work that they're doing and what they're coming up with.
Absolutely. At this time, both of the large high schools have multiple interventions in place to bring kids in that are struggling. And the outreach from the schools occurs daily to reach out to those kids. And you're absolutely correct that the number of students currently failing right now far exceeds what we would see in a regular face-to-face instructional year. There are several key factors behind that. Obviously, students not being prepared to learn virtually, and they're learning just like the teachers are learning the most effective way to do it. There are also some attendance issues that go behind that, and just as kids struggle in a brick and mortar school and face-to-face instruction, if you're not there, you can't learn. That's amplified within the virtual setting, particularly when we have things, that this isn't a real term, but shadow attendance of kids that are going in and saying they're in class, right, virtually, but then not actually going to class, right, because of the model where we try to provide multiple avenues for kids to attend class, both synchronously and asynchronously. Sometimes that's very, very difficult to actually monitor. Now, I know, we have 2 SROs in the room with us right now, and I know that they have been running around chasing down absentee students to find out why they're not logging in class and all that, utilizing our counselors, utilizing our social workers, and trying to verify those kids that we know aren't logging in. So again, multiple interventions at both schools. This is an ongoing problem. Without a doubt, it's an ongoing problem, particularly when you look at 2 of the 3 large high schools. And again, this was mind-boggling to me when we ran the data. Enrollment's gone up, even in the pandemic, at Elko High School and West Wendover High School. Current enrollment exceeds right now what ended the year last year at those 2 schools. Right, because we had small senior classes graduate and large 8th grade classes come in. So enrollment at Elko High School, even with all of the kids that have homeschooled, all the kids that have gone NMVA, enrollment at Elko High School is up about 30 students from last year. And so they're not dealing with smaller class sizes and they're not dealing with targeted. It's about the same in a completely different setting. Mr. Wickersham and Mr. Taylor, I believe, are on the line. So, if they can talk specifically to some of the things they're doing, or if the board has specific questions for them or me about what's going on at the schools, we're happy to field those at this time.
Did you see any increase in the numbers that were going to the virtual academy before the middle schools opened up for hybrid?
Right before, yes, we did, right? Because again, we saw a slight increase, well, again, not even a slight increase, Mr. Walls might be able to talk this, but before the elementary schools went back, we also saw an increase in enrollment in the new NMDA staffed by Elko County teachers. The secondary schools still are not. So most of the students that went into NMDA went into the elementary grades. Most of the students in the secondary level that were in NMDA were at the beginning of the year, because the model that we have in place, particularly at the middle schools and the larger high schools, when we do come into the hybrid, is because of the attendance model, particularly at the 2 larger schools with the 1 day of attendance per week. Those students at the larger schools can choose to stay full virtual while enrolled at their school and stay with their teacher and do asynchronous or synchronous live teaching on their physical attendance day while staying virtual. And that way we keep those kids in school. We keep them with their teachers when they're going to be virtual multiple days of the week anyway. We felt, in consultation with the administrators of the school, we felt that was the best model to keep those kids in-house when we were talking about 1 day of physical attendance a week. Now, we may see a change in that if, like Dr. Putnam said, if we round the corner here and the governor releases some of, not releases, that's the improper word, relaxes some of the very stringent requirements we have with the 6-foot distancing in our older schools. If that gets relaxed and we can get more kids in there, then we can look at having more kids on campus a week, more attendance days, which of course is what we all want, right? We want kids in school more in as safely and as efficient way as we possibly can.
And is there still capacity then in the virtual school for Elko County?
There is. There is, due to some begging of the Edgenuity staff and them expanding the numbers that they allow in there. As of right now, though, we haven't seen an increase from the beginning of the year moving on towards this because of the model that we put in place to try to keep those kids attending virtually at their zone school rather than unenrolling and going to NNBA.
And I think another thing to remember is that one of the requirements that the state has made for all school districts in Nevada is that we must provide a distance learning option for those families that do not want their children to come back in whatever hybrid model, may be in place. So there'll always be that option available to families to have their children at all grade levels to be in a distance learning model.
Absolutely. Since we've gone back and have students in class, have we seen any reduction in the number of people that were homeschooling, that they're bringing their kids back to the schools? Obviously, the middle school and area right now, it's really too early to tell, but with the elementary, did we see any movement there?
Not really. No, we've seen an increase in the number of elementary kids in our distance ed schools since we went back to the hybrid model. But honestly, Trustee Cooney, I haven't paid attention if that increase was homeschool students or kids from the brick and mortar buildings.
Yeah, both of those counts in both homeschool and in NNBA district-wide are in the high 700s at this point. So NNBA is now our 4th largest school in the district, and the homeschool count remains steady at the high 700s.
So if I understand with the high schools, we're going with 3 cohorts because we can't fit the student, we have excess students. Do we know more or less on a general bias how many students we have extra? So is it like a classroom, we can't fit 2 students on one segment and then another one is 3, or is it much bigger numbers than that?
So that's a difficult question to answer because it's far more complex than that, right? It's difficult to look at the numbers at a high school the same way we would look at them in an elementary school, right? Because in elementary school, obviously you can have set number of kids in there and those kids are in that classroom all day long. Whereas at the high school, you may have 30 kids in an English class in first period, and then they disperse to elective where there's 12 kids and maybe there's only 15 kids in a welding cohort and things like that. And then the very next period, now they're all in algebra, and now it's, 2 groups of 15 kids coming in. And of course, we're talking about in a regular setting, right? So in order to do that, you have to ensure that within those classrooms, throughout the course of the day, throughout the, dozens and dozens of different classes that are offered at the school, that none of those classes exceed the numbers allowable physically in there with the 6-foot distancing. So, and again, Mr. Whipsham, Mr. Taylor might be able to speak directly to this, but having more than about 15 kids in any class throughout the course of the day pushes those classrooms to the max with the 6-foot distancing, specifically when we're talking about Elko High School and Spring Creek High School. So we have to keep in mind, the buildings at Elko High School were not designed for, it's an old complex.
Well, my question was more for, can we project maybe a rotation every other week? For example, 15 students, we'll cap it at 15 for now, for the argument's sake, go in on week 1, then the following week, those 15 or 10 of those go to online, and then we rotate, you know what I mean? So they each get 2 or 3 days or 2.5 days? Is that possible, or is it a logistic nightmare?
It's a logistic nightmare, right? But again, everything that we're doing right now is a logistic nightmare, absolutely. Which is why that extra time was put in place for the secondary schools, right? Now, the junior highs have less course offerings, so they were able to manage that logistical puzzle sooner than the high schools. One of the other problems that we have to focus on is that when you get to the high school level, the idea of only doing cores goes out the window, because every single class those kids are taking are required to graduate, right? So you don't just get to say, well, you know what, if we eliminated art, we could do this. Well, guess what? You can't eliminate art because those kids required on that elective graduate. So looking at that puzzle, it's a puzzle within a puzzle within a puzzle. Utilizing outside buildings or things like that, again, becomes a logistical nightmare. Because if we're at Spring Creek High or if we're at Elko High, where are those classes close enough to be able to allow those kids to go to that class for 1 period and then turn around and hustle back to wherever their next class may be, right?
Use the college, because the college is going mostly online, correct?
It has, right? It has gone mostly online, but even that, right? I mean,
It's a transportation
it
issue.
is, it's an issue. And that might help Elko High School, that doesn't help Spring Creek High School. you know? So, yeah, absolutely. There's definitely some issues. And in my opinion, the administrative teams and their reopening committees are doing an outstanding job coming up with these plans that get kids on campus as much as possible in the most consistent way possible, right? Again, the governor comes in, relaxes some of these things, absolutely we can increase that to a AB cohort like the junior highs are doing. Again, they only have 3 feet. That's why we're able to go in AB, you know, at Adobe and Spring Creek Middle School where the student populations are also in the 700s.
And are we encouraged at least with the fact, the biggest change here with the middle school starting, we've done A and B now because we did Thursday, Friday.
Yes, we did. Yeah, that's why we started on a Thursday,
And,
absolutely.
So the biggest change compared to the elementary schools were that the students are moving within the school.
Mhm.
So do we have positive feedback for the possibility, basically almost a test run for the high schools? Is that, or have we already run into problems with the middle schools, with the kids transferring classes?
At this point, we have not, right? And again, it's been very early, but it's been 4 days,
Yeah.
4 attendance days. And so far, they've done a good job. But in the first few days of elementary attendance, we also didn't have a whole lot of exclusions. That comes later, right? So we have to keep an eye on that. And yes, it is somewhat of a test run for the secondary schools, just like the elementary schools were a test run for the junior highs. So all right, this is what we saw was working. Let's move that up to the junior highs. We're gonna see what's working, what doesn't work, and then allow those 3 really, because we can't forget Wendover, right? Wendover is also a standalone comprehensive 4th-grade high school. Yes, it's smaller than Elko and Spring Creek, but they face the same problems because their physical building isn't as big either. So it's all proportional. So, you know, when we look at that, it will be a test run. You know, the junior highs were the test run for those as well.
Okay.
Absolutely. And again, I know I should say a little while ago, but the reopening teams made up of community members, parents and kiddos, administrative staff and teachers, and all those schools are doing an outstanding job. And they've come to terms in those committees that this is the most effective way to get kids back now. And with, you know, in regards to the large amount of students that are struggling right now, that's one of the reasons why we want to get them back on January 4th. The semester doesn't end for a few more weeks after that. So we can have a fairly intensive, you know, when the kids are there, the reason we want them back is to try to fill those gaps before semester exams. And anyone who's spent a lot of time in a secondary school, as teachers, as administrators, whoever we are, there are more Fs right now than we're used to, but 2 months before the end of the semester, there's always more Fs than there are at the end of the semester. Because kids see this and go, oh my God, I don't want to fail this because I don't want to retake this class next semester or next year. So I do expect to see those numbers improve. I also do expect them to be higher than we would in an average year, because this is not an average year, without a doubt.
And I think to, you know, really kind of support what you're concerned about, Ms. Wines, about the failing and about the struggling that students are having in an environment that is not a normal environment for them. That is a big concern, and you're absolutely right to bring it up. And you know, again, I'm really impressed with the efforts that the schools have come up with right now in this environment to get kids in on campus, to provide that sometimes one-to-one support to them. So we have opportunities right now, and I want to emphasize it and bring it up because I'm impressed. I know we all are with the innovative and creative ways that the schools have worked to provide support for students. So we've got students coming on campus and working on these areas that they're struggling with, and working on helping them to develop those habits of attendance and those habits of completing work and working, and, you know, sort of that self-motivating characteristics that they need to develop to be successful in this environment. So yes, it's a concern. It absolutely is. And it's important to talk about it, and also important the work that our schools are doing to provide that for our students.
I had a question for the high school principals. Today I was doing an observation of one of my student teachers, and I usually expect students to be there, but there were no students, and he had mentioned that the schedules had changed to accommodate, I guess, this one day, and that has kind of led to students not necessarily attending like they would normally would. Is there something being done about that, or nothing? I mean, probably same old, same old. I know in my classroom, we had these same situations with a lot of students, and I know they're just magnified or amplified, as Chris was saying.
Was that directed at Mr. Wickersham?
Yeah, I was just gonna see what they thought, Sean and Tim.
Mr. Wickersham or Mr. Taylor?
I'm unsure of your question, Mr. Zeisler.
I think that's.
I was just wondering if you instituted a new schedule in the last few weeks, I guess? And is that contributing to a wider non-attendance or non-submittal of assignments or anything like that?
No, we've had the same schedule at Spring Creek High School since we started with distance learning. We do have a modified schedule for tomorrow for the early release, and we did send out that schedule for tomorrow, but our schedule has been the same.
So maybe it's just at Elko High School that things have changed, maybe?
Mr. Zeisler, I think I can speak to what you're talking about, I think. And I think what you're talking about is the live meet schedule. That is the synchronous learning. Okay, so what we did in the beginning when we were first putting this together is we allowed teachers to construct their synchronous learning sessions pretty much to their own preference. That is what day they had them, and you know, they could have them on Monday and Tuesday, or if they chose, they could do Monday, Wednesday, Friday. We didn't give them any restrictions. What we did tell them is you need to have a specific number of minutes per week, no more, no less, you know, between 60 and 90. We gave them that guideline, but we didn't tell them what days to do that. As we got into early mid-October, the common complaint that we heard from teachers was, my kids aren't attending my synchronous learning sessions. The attendance rates in our synchronous learning sessions were very low. A lot of kids didn't come to live meets. And in speaking with students, one of the things that sort of jumped out at us was that because that was so random, and because teachers had liberty to construct that as they wished, we had a number of students who, just because of the vagaries of the schedule or bad luck or just chance, some students had all of their live meets in their classes that in their schedule, perhaps on Monday and Wednesday. In 7 classes, all of their live meets were on 2 days, or in some cases they had 5 live meets on one day and 1 or 2 the rest of the week. So I think the schedule change that you're talking about is 3 weeks ago, I asked teachers in their next 2-week planning cycle to please change their live meets so that they were standardized across the board. That is to say, we asked for periods 2, 4, and 6 to have their live meets on Mondays and Thursdays. And we asked for teachers in periods 1, 3, 5, and 7 to put their live meets on Tuesdays and Fridays, so that students had more of an even load across the week. We knew that our attendance in live meets was very low, and we were hoping that if we made it predictable and stable and standardized across the school, that we could increase that. The other thing that we wanted to do is be able to publish that. That'll be done tomorrow on our website, as well as on our Facebook page, so that parents know when their kids have live meets, and we can encourage parents, hey, if it's Monday, your student has live meets likely in periods 2, 4, and 6. Please encourage them to attend. That way we don't run into the old dodge with students and parents where the parent says, do you have any live meets today? And the student says, nope, had them already.
And does the potential then exist, Tim, for the students to maybe have a similar schedule to what they had before with the live meets?
As in revert back to what it was prior to the change?
No, that they might not see an actual change in their schedule because of how the periods are set up.
I'm sorry, Mr. Zeisler, I don't quite understand what you're asking.
So I was talking to a student and they said that their schedule was essentially the same as the one 3 weeks ago that they were doing. So some students might see a radical change versus some students seeing very minor changes in that schedule then?
Correct.
Okay.
So, Mr. Wickersham, have you seen an improvement in students showing up to the live meets by
Well,
standardizing?
it's difficult to measure. The data that we have there is anecdotal. And I've asked teachers, again, everybody's on a different planning cycle. So I gave them a couple, 3 weeks to get that standardized and asked them to have that done before Thanksgiving break. We'll know in another week whether we've had an effect on that or not, I'm guessing.
Thank you. I just had some other questions too about substitutes at schools and the pools. Are we doing okay? I've heard stories that teachers are being pulled to other classrooms, some cross-contamination going on there,
Well-
with students even being pushed into other classrooms.
So I have said, and we've all talked about at great length, the fact that we are working and have been successful, we feel, in mitigating a lot of the challenges that we saw coming up ahead of us, with the exception of staffing. And that is and will continue to be a challenge as staff members have to go out for either, for any sort of exclusions. And as the rate is increasing in the community, it's increasing in the number of people that are out. I've also said, and Dr. Putnam supported this evening, that the transmission it's not going to happen in the schools. We're doing great. It's what's happening in the community. So when the transmission is increasing in the community, it impacts our ability, to keep teachers and staff and students in school. So what's happening is, as that's increasing, we're seeing it happen in the schools, that we have more and more staff that need to be out for either the 10 or the 14 days, depending on where they fall in that in those parameters. As that's increasing, we have come up with tiers of ways to address our way of keeping classrooms covered. Now, let me just kind of put that over here and say this. At our elementary levels, we have been able to, because just of the nature of the way an elementary classroom goes, to keep kids in cohorts. Pretty much a classroom is a cohort. At the middle school level and then at the high school level, we don't have that cohort ability because students are changing classes. So that is going to be the majority of students who will not be in a cohort and who will be changing classrooms. At the elementary level, we are, as I said, we have tiers of ways that we go about covering for a classroom. So one of the possibilities may be that, let's say as an example, we have a school that has 3 second grade classrooms. We have 1 second grade teacher who is out, and we are unable to find a sub to cover that teacher's classroom. And it's the morning of school and kids are on their way. If we have the ability to maintain social distancing, and we are able to push the children into the 2 other existing second grade classrooms, then that is one of the options that we have available to us. It is not our go-to. You can't do it every single time. There are certain parameters that, identifiers that would prompt us to do that. And I also made sure that I checked with Dr. Putnam to find out if that would be acceptable to be able to do it, and he indicated that it would be. So that is one of the things that is happening. To some degree, again, I think it's really important to know that that is not our go-to, because this is the one grade level, the levels that we're able to try to maintain cohorts. So, but that's one of the things we can do. The other thing that we do, and again, These are not go-to on the list of first things you do. It's kind of down there as far as the layers go. But for those schools that have the shortages, and we've tried the other things that we have in place, a specialist teacher who is teaching completely online may be asked to fill in for a classroom. Again, that's not a go-to, but it is something that is one of the options that might be in place if certain parameters are in place. So.
And then the other thing I was hearing from multiple schools was the situation, parents coming onto campus without masks. Is that something that we're dealing with or not yet?
Sure, and I'm going to go back to what Dr. Putnam said. Our ability to be successful depends on our community and depends on, the people that are coming just to pick up their children. We have very clear mandates and restrictions that we are following, and we are asking the community to follow. If you are coming to pick your child up, please wear a mask. We are not, we don't have volunteers coming into schools. We're keeping a very isolated bubble around our schools. The only time that parents might enter into the building is if they have to pick their children up. And they cannot enter the building without a mask. And we ask that all parents and board members sometimes go to visit schools. We are asking everyone to please follow the mandates. And that is something that we will enforce to the best of our ability. We want to be successful, and that means everybody.
And it does sound like, within the building, that's being adhered to,
Yes.
but what I worry about are the times when students are being released to their parents and teachers are with those students and parents are approaching those teachers without masks.
Yeah, and we are, again, enforcing that to the best of our ability. We ask the community to please, when you are on a campus, wear your mask for the time that you're there.
Well, that kind of falls into what Dr. Putnam was saying, where we really need to call the community to help us out on that one. Sort of the last meeting we were saying where people were sending sick children to schools, like, don't do that. We can't have that happen anymore, and it's going to trickle down, and eventually it's just going to put us to a stop. Same as if you have your license to be a sub, come forward and help us out, because we can't. If there's no teachers, we can't keep the schools open ultimately.
Other questions from the board? I just wanted to say thank you to the schools for the work they are doing. Those that have all the students, there, those who have part of the students there, some of the bigger high schools that just have some kids coming on campus occasionally. I have a couple of really great students in my house that know they have to make this work, but they're still struggling from time to time, and I appreciate the teachers that have reached out, or they've reached out to a teacher and the teachers have, helped to make accommodations to help them with their classes, because the reality of students failing in a very different setup is stark. And I really appreciate the teachers and staff that have reached out and made it possible for kids to overcome those challenges. One other thing that I just wanted to point out, because this was asked several times, we talked about how every school community was impacted by COVID. And I think people think impacted means we have positive cases in every school. And I think it's important that we know that schools being impacted doesn't necessarily mean we have a positive case. There are several things that could mean. That could mean someone is a close contact. That could mean, a variety of things. And I just think it's important we point that out, just so that people in the communities aren't being overwhelmed and thinking, oh my goodness, my school has positive cases. Maybe I shouldn't send my kids, or, I think it's just important to state that can mean several things. And as long as your child is healthy and, you are healthy, please send your child to school. The schools are definitely working really hard to keep things clean, keep things open. And again, the community will do their part, then we can continue to move forward and have kids in school. So that was the only other thing I had. Any other questions for our superintendent before we move on?
One last question, just about the dashboard. And maybe I misunderstood. I thought at one point, Bobby was saying that we might break it down to regions, if not schools, but at least Elko or Spring Creek, Wells, or in the bigger area. Obviously, the small schools, no, because it could be a little too obvious, but so that we don't just have 21 cases, but we know more or less if it's which region needs help or support or.
Right. So we are adding to the dashboard.
Okay.
And that, I think that information, and I'm glad that you brought it up, is going to be helpful for families. It goes along with President Dastrup was just mentioning. The information that we're going to be adding is listing the schools and identifying, how many active cases may be in that school. And, as President Dastrup just mentioned, schools are not impacted just because there's an active case. There's close contacts at all different levels that could be impacting it. So that's something we're going to be adding, plus some other information about closures. We want to be very transparent about why we may get to a point where we have to close a school. It may be because of the amount of, or the rate of positivity in a school in a certain location. I mean, there's many layers to it. But it may also be, as I've mentioned before, because we don't have staff to cover the school, because we are keeping up with contact tracing. As Dr. Putnam mentioned, we have a team here. Our nurses are phenomenal, and they are doing an incredible job with contact tracing. It's a very complex and time-consuming job. And there may come an occasion where we need to close a school because we have to completely do contact tracing. And in order to be able to do that effectively, we need to close and not have students and adults and everybody interacting. So when we get to that point, then that's information that we will list as well too, so people know why. And I just want to mention, it seems like that would be an easy thing to be able to do, because I know we're really anxious to get that information out, but I just want to mention that, again, working through every incident of a positive test or close contact, every situation you could possibly think of is happening, and nothing is cut and dry. And so being able to keep track of those numbers and be able to put them in the right categories, our nurses are amazing. They're not epidemiologists, so they're doing this work as they're learning and as they're receiving training, and it really is exceptional what they're doing. And they're getting to get that information up as quickly as we can. We want to make sure that we're accurate and that, again, there's transparency. So we're excited about, excited is maybe not the word to use, but we're looking forward to being able to provide that transparency and that information so people can make informed decisions about schooling and what they do with their children.
Anything else? I just want to say thank you to Ms. Stalkey for continuing to work on grants. As we know, finances are going to be rough, and so thank you for continuing to bring grants into our district, because we certainly need them. All right, we will move on to item 4.1, our consent agenda.
Move to approve the consent agenda.
Second. Thank you. We have a motion and a second. Any discussion? All in favor of approval, please say aye.
Aye.
Any opposed, nay? Chair votes aye, and the consent agenda is approved. Item 5.1 is a report from our NASB director.
Okay, we had a meeting a couple weeks ago, a Zoom meeting. We got an update from Jessica. Can't think of the last name, Ferraro. She's a lobbyist for NASB. And Pete Gogachita is going to sponsor a bill for the school trust lands to get that in front of the legislature. And her thought on the appointed school boards was there's going to be a lot of focus on the budget, and that might get lost in the shuffle. That budget might require a lot of attention. So might slide through one more session without that becoming a big deal. For new board members, there's a Zoom training in January, and then in March, there's a one-day training at the convention they're gonna try to have. And I jumped the gun on the officers for the NASB. They, I don't know why they have to call a president and a president-elect and then a vice president. But Laurel Crossman is the president, and Catherine Whitaker's the president-elect, and the other offices were the same, with Nicole Benguchia being the vice president and Lola Brooks being the legislative chair. The Pacific region for NASB, it's Alaska and Washington and Oregon and California and Nevada. Stacy Wilkie's on that board. She's from Carson City. And then the State Board of Education, Mike Walker, has got put on that board. He's a board member from Carson City. And the Teachers and Leaders Council, nobody knew if you got reappointed or not. You did?
I haven't received a letter from the governor's office, but they've got all the information. And Mike was also on that Teachers and Leaders Council.
Was he? I don't know if he didn't say anything about that, but he got put on that State Board of Education.
If he was on the state board, then there's another opening
Oh, yeah.
on the Teachers and Leaders Council.
Mm-hmm. And then I jumped the gun on the platform, but we approved it so I can share it with you guys. I already did. And I volunteered to host a meeting last June, got canceled, so planning meetings, upcoming meetings, I volunteered to host it again. If we can do it in person, it'll be in Halleck at the 71 Ranch. And that's about it. Seems like the meeting went on a lot longer than that.
We appreciate the Cliff Notes version. Do you have dates on the January and March training?
I don't have those yet.
Okay.
No.
All right, those are forthcoming. All right.
For those, they could be on the website, I think.
Yeah.
I want to say like the 12th or the 14th or something like that. Don't quote me.
And Deb was still, she hadn't nailed that down yet. But at this meeting, I haven't looked at the website. Maybe she has. I haven't got an email from her.
We won't jump the gun. We'll know that there's a meeting in January and March.
Be patient.
All right, any questions from the board? All right, we'll move to item 5.2, items from board members.
Yeah, I just was gonna tell everybody I did tour Northside today. I wanna just kind of reiterate what Dr. Putnam said. The staff, the principal, the teachers, the kids, they are all doing amazing. I was very, very impressed. I was happy to see kids in school. The kids are happy to be in school. I just took away nothing but positives from the experience. They're working out the bugs as they go, and there is a new challenge, I'm sure, every single day that comes up. And they are being extremely creative in how they're dealing with those different obstacles that might come up on a daily basis. But overall, I was very impressed. It seems to be working. I ran down a parent as she was leaving the school to ask her how she thought things were going, and she indicated to me that it's much, much better than the online only situation, that she thinks her kids, just in the short time they've been back in the hybrid, have not only has their learning increased, but their overall attitude. They're just much happier. So, like I said, nothing but positive experience, and I'm just really, really impressed with our teachers and our staff. And like I said, the kids were doing amazing. Little little tiny kindergartners were doing an awesome job keeping their masks on and doing their social distancing. Everybody was extremely well behaved. So that was my experience today.
Cool. I had an opportunity, I toured through the new science building and the science labs and the performing arts. Looks like they're getting with it. They were a little bit behind, it looks like, because of COVID and other getting materials on site. But this evening, as I went around the corner from 12th Street around, it looked like they had another shipment of iron. So they've been waiting on that to get that. To echo the items that Candace is just mentioning, I've had a number of parents express to me that just in a shorter period of time that we've had the kids back, that the kids are happier than they've been in a long, long time and excited to be going to school and that sort of thing. And a final item, in the discussion, I was initially concerned, and I think I expressed that when we were looking at having the elementary kids coming back just AM for a 3-hour period of time, and then the PM. What it seems to be, the teachers are able to focus on what they want to get across to them, the students, in that shorter period of time, in the 3 hours, they're able to accomplish very, very close to what you would normally see in the equivalent of an all-day, 7-hour day. So it was really exciting to hear those specific things. And, you know, it is refreshing to hear parents talking about that social side of their son or daughter being back in school. So.
Well, and to answer one of Mr. Zeisler's questions earlier, I did ask about the substitutes at Northside, so this is specific to Northside, but she said they had about 7. You know, how long that's going to last, you know, remains to be seen, but right now, they have enough that they can, you know, keep things covered, so hopefully that stays the case.
It's good to know, because I know we've got some schools that don't have enough. Again, if someone has a sub-license or the ability to get one, please get one and come help in our schools, because I know we need subs.
I was going to say, we continually encourage our students at GPC, as soon as they earn 60 credits, to get their sub-license and get into those classrooms. So I wanted to, for my report, just extend my condolences to the families that were involved in that accidental shooting, and especially to Mountain View and their teachers, and coming together to support one another. I know, just so the community understands, you know, what teachers do for our community. It was a teacher that lived nearby that was the one to essentially be with that young man until he passed away. So thank you to that teacher and what teachers do for our students in our community.
And Mr. Zeisler, I was going to echo that. That's on my notes as well. I know we've had several tragedies in the district in the last little while, on top of all the craziness of COVID, and I just want to offer my condolences to the families that are struggling and suffering due to those tragedies. All right, any other items from board members?
I just looked up the dates for the NASB training. There's nothing on the calendar for January, but the March training or conference is tentatively scheduled March 25th through the 27th.
I think the January training is, I think they're offering it through UNR as an extended studies course.
Oh, could be.
Because I signed up for it, so I'm sure that's how that, so it's not necessarily going directly through NASB.
That came across in an email, I think, didn't it? Yeah.
And it's all online.
From that other school.
All right, any other items from board members?
Sorry.
Go ahead.
I was looking up extended studies classes. I just wanted to let the board know we have been trying to be extremely proactive with our messaging about keeping schools open. And I don't know if you guys have noticed on Facebook, we've been posting regularly little pictures and videos and things, just encouraging people to, we've got a few things like help keep our kids safe, healthy, and in school. Our students, educators, and staff are counting on you. Be considerate of your community, your family, yourself, and every exposure to COVID impacts our schools. I strongly encourage you guys to share those as much as possible. Right now, they're not widely seen, and I think that's part of that community buy-in that we really need to start working on and message very cohesively across the district. I know I've spoken to some PTAs or PTOs who have agreed to share them. Amanda with the county is sharing them through the COVID-19 page, but every share and every view helps get that message across, because we really need to let our community know it's great that we're back in school. It's awesome and we love it, and it could go away like that. So we really need some community buy-in to keep that going, and I would appreciate it if you guys helped us out, so thanks.
Thank you. All right, any other items? All right, we'll move on to item 6.1, approval of the accounts payable.
Move to approve.
Second.
Thank you, we have a motion and a second. Any discussion?
I had a question if Jerry's on. Not sure if she's on or not.
I believe so. Jerry, are you there?
I was just curious as to what the Sherman and Howard LLC.
Yeah, Sherman and Howard, they facilitated part of the pay-as-you-go information that went to the county.
Oh, great. Okay, thank you.
And then I was just wondering about the read by grade 3 refund. Is that just leftover money that has to be refunded to the state that was not
I can
used?
answer.
Oh, thanks, Nancy.
So it was right when I started, we had to return funding that we didn't use. And within that transition between Holly and I, that got missed, and then Jerry found it as we were moving forward in this fiscal year. So I just sent the check back. So it's
Gotcha.
from FY19.
Yep, okay.
All right, any other questions? All right, I will disclose that I have a family member whose employer is listed on the accounts payable, so I will be abstaining. All right, we have a motion on the floor. All in favor, please say aye.
Aye.
Any opposed, nay? Chair abstains and the motion carries. Item 7.1 is a final opportunity for comments from the public. Please.
Hi, my name is Katie Hamburg. I'm a special education teacher up at Mountain View. And I just wanted to bring to your guys' attention, we've been really struggling in our special education department to get substitutes for our paraprofessional positions. Out of the 6 special education staff Friday afternoon, I was the only one available to service students for a variety of reasons. And today we were up to 2 people available to service students. I had a substitute teacher tell me yesterday that she avoids accepting paraprofessional positions because they pay less than the regular teacher positions. So I know that, I want to advocate for my students. I'm only one person. I can only be in so many places, and they have a legal right to services, and right now I'm not able to provide those. So I just wanted to point that out. I'm not sure there's anything that you guys can do, but just wanted to let you guys know.
Thank you. Any other comments? All right, we thank you for joining us this evening, and the next item on the agenda is a motion to move into closed session. So again, thank you for being with us, and we invite you to excuse yourself so that we can go ahead and move into closed session. I guess we can start with a motion. Thank you. Second. I have a motion and a second. All in favor, please say aye.
Aye.
Any opposed, nay?
I am abstaining because I'm going to leave since my wife is on the other side of the table at the negotiations team, and it is a conflict of interest. Just so everybody knows that I received a legal memo in 2018 when I first came on the board that expressed this, and I abstained from these sessions, thankfully, so thank you for the out every time at the meetings. I like this.
Thank you.